if one person at your table can report back as to some of your ideas as it relates to this question, and then remember it for the next session that we're in as well. But if we could have each, we'll start with table 6, and as we said, table 4 will be next, then we'll just keep going. All those look like ones to me because of my eyes. Go ahead.
Well, we're good academics, which means we're really good at defining problems and not finding solutions. We talked about, counseling needs, and, I talked a little bit about my experience that my institution has started adding counselors embedded in the academic units rather than doing them centrally. Because we have situations where we can't get people into counseling. But we've also talked about situations where, there are counselors, but people won't go to them. And so there's a disconnect in availability of services and use of services. Sometimes it's services that are underutilized, and sometimes we just can't keep up with the need. So I don't know that we have solutions there, but I think that we need to come up with some strategies that we can teach to our students. Helping them understand all of these factors and understand that crushing boulder that you're now carrying instead of pushing is really critical. But what do we do with that? And I think that's where I'm struggling.
Right. And even when you hire someone and you hire a psychologist or a psychiatrist on campus and you give them a faculty line, then you have 9 hours, right? And so I'm only going to come because I'm going to continue to do my research, and it becomes this whole big thing, because I was a proponent that there needed to be a counselor in every dormitory that existed on campus, because that's where alcoholism, all of the different things that happen, or should it be connected to the police department? Where can we get our services so it's right there, but that is something that I think I would like you to kind of report back, because there is no answer. Table 4.
So we started the conversation as well. And, one of the things that was discussed was, how do you move from a sick care system, because currently we don't have a healthcare system, it's a sick care system. And so while a solution wasn't discussed amongst the group, one of the things that I would propose is looking at, and this is actually not necessarily policy, but it is, I can say policy, is that reimbursement around healthcare and well-being, health psychologists. And so it's not just a place where people go when they have problems, especially if you're looking to address this with academic institutions that may be creating a true mental health service where if people want to excel, that you kind of shift the perspective and broaden it, such as what Senator Moulton talked about, or Congressman Moulton discussed this morning, making it broader. And that may help, because I think that academic institutions want to be able to say that their students are completing successfully and also keeping the environment safe. And so maybe changing the argument and broadening it.
Great. Table here? Your table?
I'll summarize, because then I can throw in something I didn't even get a chance to bring up. We needed more time.
I know. I see Patricia out there.
Our table discussed the need for greater wraparound services, if you will, particularly for those learners who live outside of the community, right? So, or outside of the learning community or the traditional environment of the college campus, so to speak, right? But those who live beyond that, and who have even less access to services, even if they're limited services within that grounds area. And then I also would add that, from a policy perspective, I think it's all of our, it's upon all of us to really fight for greater protections of mental health services for our students. and not just protecting what's there, but I would say even expanding it. So first aid mental health, for example, on all campuses. So we can reduce the stigma and bias around mental health services. We require, back to school physicals, even at the college level. Why aren't we teaching our healthcare professionals who are doing those exams to integrate a few questions about mental health in addition to the physical health when we send our learners back to schools? So just a couple thoughts.
Great.
Thanks. We had a conversation around the role of advocacy skills for health professions, any of them. And so Carl was sharing that in the mental health world, advocacy is one of the pillars, really, of the ethical domain of practice. I'm not so sure it's as crisp in the medical education world. I mean, it sort of probably gets thrown in there in the system-based competency that you should be able to advocate, but when it comes down to it, can you write a letter? Do you know how to navigate the system? Can you articulate what it takes to go from idea to policy to bill in the House? So really making that concrete skill a little bit more ubiquitous.
Excellent. I couldn't have ended it in a great way. First, I want to say my bias is that we're talking about all college age, but we also know that this happens at anyone at any age. But advocacy skills, every time I go to the Hill, before I make an appointment, I Google as much as I can learn. And I've kind of found that there's a lot of legislators and senators who are grandfathers and their children are autistic. So I always start off, this is what social work does for autistic children. And it brings some sense of engagement. Oh, wow. I think it is important for us to kind of remember that there are real people making legislation or pushing legislation or what they'll sign on to. And how do we connect with them? Most of the time you're usually talking with staffers, but when you get that rare opportunity to talk directly to, what do you know about that individual that may help you substantiate your case? And advocacy is something that we all have to be vested in. Right now, we know that we're in this quagmire. I hope it doesn't happen forever. But, just yesterday, we had our 87th shooting in the United States. Schools are no longer safe. Universities are no longer safe. There's open carry laws now. So when you're teaching, someone can put their gun right up there. How does that affect you? To cut out mental health services at a critical time when I think it's needed everywhere. And I agree, Dr. Carter, that we kind of come from a sick perspective rather than a healthy perspective. Why is it wrong to have a mental health check? In child abuse, we now strip the body no matter what. Child comes in, doctor strips the body, looks at the entire body, even if the child's coming in for a cold. Our mind is as important as our body. It is part of us. And so beginning to talk about and doing our homework and really trying to figure out what policies should we shift, I think is critical to some of the conversations we're talking about here at the Global Forum, because there are parts of legislations on the books that we don't even know about yet that are untying all of the progress that we have made. And so kind of understanding what bills are there and what's being untied. And this being one, I was shocked to know that major universities are thinking about cutting out mental health services. What does that say for the conditions of education? Yes, Dr. Carter.
So I noticed that there was a slide that you skipped, and I really wanted to just speak to that because I had a real-time experience with that today in this session, which is the unconscious bias piece. Very powerful. So I will say this, is that I grew up bi-coastal and California, rural South Carolina. As a physician, one of the things that I think is so important is to, and there's like, I'm going to quote a book where it says, physician, heal thyself, that there are things that we as clinicians have to work out, I think, because in the course of life, we all experience things that we need to heal from. It may not rise to the level of disease or illness, but we still need to heal. And in order to care for patients who have difficult life situations, healing is important, I think, to be fully present. So with that, I like to say that I was raised by my mother and father in California, and in South Carolina, I have 2 mothers. So I was raised in South Carolina with 2 great aunts, which I did not have the awareness until I was in my late teens, early 20s, that my 2 great aunts were partners. They were life partners, and no one talked about it. And the reason why I shared about doing the self-work is that I have, and maybe it's just because I am from Los Angeles, tended to do a lot of workshops just to learn more about myself. And I discovered in doing a workshop what sadness I had around that there was not an acknowledgement of their relationship and how I lived in that environment every day. And I just felt so sad for my great aunts. But it allowed me the process to heal and to acknowledge that in a group setting. And so the reason why I'm bringing this up to tie back is, if you noticed, I wrote Marilyn, because during this workshop, my great aunts were so much on my mind that I know about the cues, but yet I miss that. And so that speaks to how unconscious bias, it can be anything, and it's having that self-awareness and the willingness to acknowledge it, and sometimes real time to apologize for that in the moment. Because I think it's a very powerful and human thing to do, which then connects us with the person that is sitting across from us. So that's it. Thank you.
Excellent closing point. I hope you all enjoyed this exercise and put it to use. And I will call on all of you in this next session to talk about the policies. Thank you so much.